Namaste. Welcome you all for the yoga session. In this session we are going to use a mat and a blanket. We are going to focus on techniques to develop controlled movements of the spinal column. With some standard stability postures. We shall begin with postures for the core muscles.
Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Feel also the posterior region at the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As you exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Rise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch in the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Stretch the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring is very crucial. So feel the stretch. Relax the left leg. Right leg up. Fold. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Change. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As we inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release the right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis, because this is the region which takes a lot of loading, and these postures prepare one to safely practice other postures. Release right leg, change left leg. Fold from right hand, hold the ankle joint, pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold, from right hand hold the ankle joint, pull, from left hand push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, fold the knee, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where the thick skin, the thoracolumbar fascia is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yogasana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll on to the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system.
Sit upright on your heel. Keep a blanket below the knee. Watch your breathing. Come to the all fours position, palm below the shoulders, knee below the hips, trunk nearly parallel, middle finger pointing forward. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Breathe well. Stretch the feet back. Press both the palms. Inhale, exhale, bend back. Well, open the shoulders, chest and navel up, look up. Stretch the toes, tighten the calf muscle, Bhujangasana. Squeeze the buttocks, push the tailbone. Look up. Complete hyperextension of the spine. Inhale, come to the all fours, exhale, bend forward. Take the hips closer to the heel, forehead closer to the mat. Inhale, come up. Exhale, bend back. Keep the palms pressed. Feel the pressure on the palm. Well, open the chest. Lift the neck up the clavicle and look up. Feel the stretch in the pelvis. Activate the calf muscle. Stretch the toes back. Inhale, come up. Exhale, bend forward. Keep the palm pressed. Keep both the arms straight. Take the forehead close to the ground. Do not hold the breath. Breathe at ease. Feel the pressure between the abdomen and the thigh. Inhale, come up. Exhale, bend back. Bhujangasana. Very nice hyperextension for the complete spinal column. Well, open the chest. Activate the muscles of the upper arms, forearms. Well, open the chest. Pull the shoulder blades slightly down and then closer so the chest is elevated. Inhale, come up. Keep the palm pressed. Exhale, bend forward. Shashankasana. In this you may see a flexion of the trunk. So we are doing a very soothing backward and forward bend. Inhale, come up, exhale, bend back, Bhujangasana. In Bhujangasana, there is extension of the trunk. In Shashankasana, there is flexion of the trunk. Inhale, come up, exhale, bend forward. Match the action and the breathing. Get involved. Inhale, come up to all fours. Relax your breathing. Watch your breathing. Now gently hyperextend the pelvis, lower back, then the upper back, then the cervical spine. Look up. Sit in the all fours. Now we will try extension and flexion of the spinal column. in this posture itself, that is, without changing the position of the palm or the knees, you should be able to have a segmental control on the spinal column in initiating and propagating extension and flexion. Now start from the sacrum, the lower back, then the thoracic, then the cervical spine. Hyperextend the complete spinal column. Now flex the neck, then the thoracic spine, then the lumbar. Flexion as much as possible. Now again, mobilize the pelvis and lower back for smooth extension, then the thoracic spine, then the cervical spine. Look up. Hyperextend the complete spinal column as much as possible. Have that control. Flex the neck, then the thoracic spine, then the lumbar spine, then push the tailbone, tilt the pelvis so that you get flexion. Again, initiate the extension from the lower back, tilt the pelvis, extend the lumbar, then the thoracic, then gently the cervical spine. Look up. Initiate the flexion from the base of the spine, the lower back, and the thoracic spine, then the cervical spine. Lift the neck up, extend the neck first, then the thoracic region, then the lumbar, and then tilt the pelvis so that you can extend the spine. Now initiate the extension from the lower back, gently the upper back, and then the cervical spine, taking the chin in. Completely flex the trunk as much as possible. Again, initiate the tilt of the pelvis, then extend the lumbar, then the thoracic, then the cervical spine. Look up. So you must gain that segmental control. Now flex the lower back, then the upper back, then the neck. Press the palm, middle finger pointing forward. Extend the lower back, then the upper back, then the neck. Look up. Now flex the lower back. Then the upper back. Then the neck. Complete flexion. Initiate the extension from the lower back. Tilt the pelvis. Then get the lumbar curve. Then the thoracic, the upper back. Then the cervical spine, look up. Be watchful, be aware. Now flex the lower back, then the lumbar, then come to the thoracic. Then the cervical. So there is flexion. Initiate the extension at the lower back. Tilt the pelvis. Then gradually progress to the thoracic spine, upper back. Then gradually extend the cervical spine. Relax the neck, slowly come up. You should be able to gain control over each segment of the spinal column. You should be able to initiate the extension and flexion from any end of the spinal column. Clasp the fingers, inner exhale, stretch both arms up, palm facing out, stretch both arms, push the arms back, well open the chest. This is just to relax the muscles of the arms. Flex the arms. Sit in the all fours, trunk nearly parallel. Press the palm, middle finger pointing forward. Flex the cervical spine, then flex the thoracic spine. Then flex the lumbar and the base of the spine. Extend the cervical spine. Then that extension should gradually proceed to the thoracic. Lift the chest. And then to the lumbar region. And then tilt the pelvis. Develop a feel for the intricate movements. Initiate the flexion from the neck. First flex the neck and watch the junction of the cervical and thoracic region. Then initiate the flexion in the thoracic region, upper back. Then watch the junction between the thoracic and lumbar. Then flex the lumbar region. Then the base of the spine. This is the flexion of the spinal column. We are initiating from the cervical region. Now extension should begin from cervical region. Lift the neck up, extend the neck, then extension should go to the upper back. No jerks. Then it should go to the lumbar region and base of the spine. So gain that control. Be watchful, be present, be pleasant. Flex the neck, chin towards the chest, then flex the thoracic region, then the lumbar, then the base of the spine. Extend the neck, extend the thoracic region, then the lumbar, then the base of the spine. This gives a good control on the segmental movements. All the paraspinal muscles stand to benefit. Relax the neck, slowly come back, sit upright on your heel. So these simple movements give a better control. It helps all the sections of the spinal column. Stretch your right hand, pull it closer to the chest. From the left hand, lock the right elbow, pull it further. Keep the right hand straight. Feel the stretch in the deltoid muscles. Pull the right hand closer to the chest. The muscles in the upper arm get a good stretch. Release both arms. Chain, left hand stretched. Lock from the right hand, pull it closer to the chest. Release both arms. Be seated upright. Watch your breathing. Sit in the all fours, middle finger pointing forward. Keep the trunk nearly parallel. Watch your breathing. Right leg forward, foot between the palms. Flex the right knee. Look forward. Watch the line and length of the left leg. Left foot stretched outwards. Tighten the left calf muscle. right hip is in flexion, left hip in extension. So this differential movement helps the mobility of the base of the spine. Keep the palm pressed. Breathe well. Slowly come up. Then keep the right leg at 90 degrees, then bend the trunk forward, taking the forehead towards the right foot. Watch the pelvis and hip complex. Slowly come up. Take right leg back. Chain. Left leg forward. Keep the palm pressed. Left foot between the two palms. Now flex the knee, chest and navel up. So these movements help you to get a better mobility for the pelvis and hip complex, left hip inflection, right hip extension, left knee is flexed, right knee is neutral, left foot in dorsiflexion, right foot in plantar flexion. Look forward. Slightly extend the knee to 90 degrees. Let's keep the flexion at 90 degrees. Then gently bend forward, taking the head to the foot. Breathe well. Slowly come up. Left leg back. Come back to Vajrasana. Sit on your heel. Sit upright. Clasp the fingers. Inhale, exhale. Stretch forward. Open the face of the palm. Both arms straight. Stretch them forward. Flex the arms and then relax. These movements help to relieve the stress in the upper arms. Sit in the all fours, middle finger pointing forward. Keep the trunk nearly parallel to the ground. Watch your breathing. Raise your right hand up. Do not hold the breath. Right hand to the level of the shoulders And when you raise the right hand, do not disturb the plane of the trunk. The shoulder complex should not tilt. Right hand down, chain, left hand up. When you lift the left hand, watch the pressure variation on the other three supports, the right palm and the two knees, and keep the trunk undisturbed. Feel the paraspinal muscles, left hand down. Watch your breathing. Right hand up, right hand straight. Now with the right hand up, slowly bend back, Bhujangasana. Both legs straight. Left hand straight, right hand also up. Then slowly come up, keeping the left palm pressed, right hand keeping it up and straight. Bend forward, Shashankasana, taking the forehead towards the floor. So you have to have the control on one hand. Inhale, come up. Exhale, slowly bend back. Left hand absolutely straight, right hand up. So this gives you a good control over your movement. Inhale, come up. Exhale, bend forward. This is a combination of stability plus movement. Inhale, come up. Right hand down. So here you need a better controlled, coordinated movement. This is good for the complete spinal column. Stretch your left hand up. On your right hand, press the right palm. With the left hand up, inhale, exhale, bend back. Bhujangasana. Inhale, come up. Exhale, bend forward. You may note that this support, one of the important support is removed. Inhale, come up. Exhale, bend back. With one support less also, you should be able to do bend back Bhujangasana. So this gives a greater control over your neuromuscular coordination. Inhale, come up. Exhale, bend forward. Be in control, be watchful, be aware. Get involved. Inhale, come up. Slowly bring your left hand down, sit in the all fours. Sit upright in Vajrasana. The moment you remove one of the supports, lot of the muscles get geared up for action to maintain stability. And when you make some movements in that posture, they further help to get better neuromuscular control and coordination. Take both hands at the back, clasp the fingers, then bringing the thumbs down, open the face of the palm. That is, your shoulders should rotate back. Well, open the chest. Stretch the arms. Chest up. Your scapula should move closer and down. so the chest is lifted up. Relax the arms. We are doing the postures to gain better stability and better control for the spinal muscles. Sit in the all fours. Rise your right leg up. Breathe well. Feel the change in pressure on the two palms and the knee when you rise the right leg up. Right leg down. Then left leg up. Here you can also notice that we are going towards an extension of the hip. Hip is not in the neutral position. We are trying to move the hip into extension. That's how the legs are going up. Keep the palm pressed. Watch your breathing. Left leg down. We're going to do some movements now with this three support posture. Right leg up. Stretch the toes, keep the right leg straight. Inhale, exhale, gently bend back. Right leg should not come to the floor. It's only towards the floor. Well, open the chest, look up. Then inhale, come up with the right leg up. As you exhale, bend forward. Keep both arms straight. Take the head closer to the mat. Keep the right leg straight. Again, inhale, come up. Exhale, bend back. With the leg up, you should do all these movements smoothly, gently. Inhale, come up. Exhale, bend forward. Keep the palm pressed. Be aware of the position of all the segments of the body as you do these movements. Inhale, come up to the all fours. Watch your breathing. Left leg up. Stretch the toes back. Keep the left leg straight. Also there is extension of the hip. Now as you exhale, bend back Bhujangasana, keeping the left leg up in the air. Inhale, come up. With the left leg up, exhale, bend forward. Keep the arms straight. Stretch the trunk. Take the head closer to the ground. Stabilize, balance. Inhale, come up. Exhale, bend back. So gain control over these movements. Inhale, come up. Exhale, bend forward. Slowly come up. Left leg down, sit in the all fours. Come back to Vajrasana. Making movements in the less stable postures call for a better degree of control. So these movements should help us to gain better neuromuscular control, especially the back muscles are greatly helped in these postures and movements which have some sort of instability built into them. Clasp the fingers. Inhale, exhale, stretch both arms up, open the face of the palm, then tilt both the palm to your right side, keeping the stretch in the arms. So you are trying to tilt the complete shoulder girdle. Feel the stretch. Breathe well. Bring the arms to the center, then tilt to the left side. Keeping the neck neutral. Watch your breathing. Bring it to the center. Flex the arms. Be seated upright. Sit in the all fours, palms below the shoulders, knee below the hips. Now raise your right hand and left leg up. Watch the pressure on the left palm, right knee. Do not hold the breath. Right hand and left knee down. Then chain. Left hand and right leg. Watch the complete paraspinal muscles. How they adjust, readjust to maintain stability. Down. Right hand, left leg up. Be stable and gently bend back. Bhujangasana. Right hand and left leg up in the air. Inhale, come up. And exhale, bend forward. Taking the head closer to the mat. Ensure that the right hand and left leg are in the air. Slowly come up. Then bend back. Watch left wrist and right knee. Keep the balance. Inhale, come up. Exhale, bend forward. Press the left palm. Left arm straight. Head towards the mat. Inhale, come up. Down. Be watchful, be aware, get involved. This also helps you to develop the ability of proprioception. Breathe at ease. Left hand and right leg up. As you exhale, slowly bend back Bhujangasana. Stabilize the posture. Then inhale, come up. Exhale, bend forward, taking the head towards the floor. Keep the left arm and left leg, right leg up. Inhale, come up. Exhale, bend back. Left arm straight and up. Balance on your right hand and left knee. Inhale, come up. Exhale, bend forward. Left hand and right leg up in the air. Watch the spinal muscles, how they adjust, readjust. Slowly come up. Down. Sit on your heel. Sit upright. Relax your breathing. So all these type of movements are of great benefit to the complete trunk musculature. They also help us to gain better control over our movements. Flex the elbows, clasp the upper arms, lift the folded arms up and try to push it behind the head. So elbows should be pushed behind and further up so that the complete shoulder complex gets relaxed. So in this session we have worked on the controlled movement of the spinal column and also the movements which can give stability to the spinal muscles. Relax both arms. Namaste.